Well, the pandemic has had an impact on all Canadians, but it's hit those on a low income especially hard. There's now a growing concern that the number of homeless people in Canada may go up. It's estimated at least 235,000 Canadians experience homelessness in a year. 35,000 experience homelessness on any given night. Global's Katherine Ward now has the story of a man from Toronto who is struggling to get the help he needs.
If I didn't go to the hospital, I would have been dead.
That emergency was the wake-up call Jimmy Evans never expected. Jimmy had been in and out of the shelter system for years since arriving in Toronto from Prince Edward Island. Things were starting to get better. He managed to secure affordable housing. But on that day in 2017, years of hard living made it clear Jimmy was very sick. Jimmy was suffering from end-stage liver disease. Doctors told him they didn't know how long he would live.
They said 1 year to 2 years. 2 doctors came in. And then they said, do you realize in the past 5 months you had 2 heart attacks?
According to the City of Toronto, Jimmy is one of more than 8,000 people who fall on the homeless spectrum. For the last 2 years, his care has fallen through the cracks as he missed appointments, and doctors sometimes had a hard time finding him for follow-ups. This past summer, Jimmy was referred to the Palliative Education and Care for the Homeless, or PEACH program. Started in 2014, the program is one of only a handful in Canada that works with people on the homeless spectrum who are in need of end-of-life care. Dr. Dasani is one of the physicians. He says since the pandemic, the PEACH program is seeing double the number of patients.
What COVID has kind of done is made the safety net that supported people from moving towards more homelessness even weaker. Because of that, we are seeing more people who are experiencing street homelessness. We're seeing more people who are losing their housing.
COVID-19 has created new challenges.
People who are living on the streets and experiencing homelessness previously had supports in, say, drop-ins or respites or various shelters, and many of these places are now closed.
Since the start of the pandemic, many doctors have moved to virtual consults. The practice adds an additional barrier for these patients.
If you get a new diagnosis of cancer and you're living in the shelter system and trying to coordinate access to something like a specialist appointment when all the specialists are using phones for their visits, if you don't have a phone, then how are you supposed to get to those visits?
The PEACH team helps fill in those gaps. Leanne Trevors works as the group's health navigator. She arranges transportation for checkups, renews prescriptions, and coordinates meals, solving whatever patient problems arise.
We never want to push to say this is what you need. We'd rather ask them, what do you need and how can we support you?
Since joining the PEACH program in the summer, Jimmy has not missed a single appointment. Now he has new dreams of going back home to PEI to see the ocean one more time.
Go deep sea fishing where you can't see land and jump off the boat and go for a swim. The future is going to be what it is.
Katherine Ward, Global News, Toronto.
Well, December is just days away and the weather is getting colder. For Canada's homeless population, it makes an already difficult life even more challenging, especially when cities don't always see eye to eye on the methods on how to keep the homeless warm, such as setting up camps in parks. But as Mike Armstrong explains, Montreal is taking a new approach on how to get people off the streets.
This camp popped up over the summer. Wedged along the side of a busy boulevard, thousands pass it morning, noon, and night. The people in it say that's why the city wants them out.
They want us to disappear. Homelessness is showing up in Montreal, and they don't like it to be showing.
At its peak, the camp was home to about 125 people. That's dropped week by week. There are only a couple of dozen left. The city has an outreach program explaining to the campers there are options.
If they don't want to stay here the entire winter, then we offer them to come to the shelter.
One thing being offered this week is storage. The city's promising to pack up possessions and give them back to people in the spring. There are also 700 new beds being made available. This downtown hotel is being turned into a shelter. And there's a new city bus that's going to be making the rounds, offering a chance to warm up and another chance at outreach.
That's what it's all about, to make sure that they know that we're there to support.
The city's also trying something new. It's pairing a police officer with a social worker, creating a team dedicated to the homeless population. Right now, even the people pushing it say it's likely not enough, but it's a start.
I think it's probably the future of policing is being tried right here this winter, and that's a good thing.
The challenge continues to be getting people off the streets if they want to stay.
That can isolate.
Over the months, some have been preparing for winter. This man gives his name as Jacques and insists he's ready.
Who are they to think what I need? I know what I need. I don't need nothing except peace, respect, and liberty.
The problem is that Jacques has a nice place and then a heater and all that, but the guy besides them do not, but he's following Jacques.
Now, the goal is to get as many people out of this camp as possible before the temperature drops to -30 and -40 in the coming months. Basically, before it's too late and lives are in danger. Mike Armstrong, Global News, Montreal.